Can you hear me?
Yes, we can hear you.
Okay, good. So you don't mind, you just show the photo later, yeah? Chin, you share the screen for me later. Sifu Chin, you hear? Okay. My name is Jackson Lu. I'm going to tell a small story today from Indonesia. This story, yeah. Actually, I have another business. It's a furnace business. I operate my furnace processing plant in Jakarta 20 years ago. So another one, my factory operation is in Jakarta. And what happened one day, my partner, I have a partner over there, and he sent me some photo about this photo. I see this photo, I got so panicked. What is this about? I don't know what is it about. And he tell me this from the doctor, this is a skin disease called herpes. So they cannot solve the problem for more than a month. In Indonesia, one small village, they go and see clinic, see doctor, but they can't solve the problem. They even go and look for those local traditional doctor, to have some local traditional herbs or sort of thing. Still cannot solve the problem. So my partner asked him my idea, how? So I said, well, I have no idea at all. But look at this, it's very serious. You just bring 2.5 and 9.5 for her to drink and spray on the water, the hand and the where the body is. I think at least can help her to reduce the itchiness, the pain, But I have no idea whether it can cure this problem, can solve this problem. So in fact, we talked to the girl. The girl mother actually, this girl is 5 years old. The mother actually worked in my factory. So the story started like that, So I asked my partner, you just ask these workers go back home to bring the water to spray on the body, the hand, whatever, and drink the 9.5. But the girl refused to go back, these workers, because Indonesia worker, we pay them by daily also. Every week we give them gaji, So if she go back, she had no gaji, so she don't want. So I said like that, never mind, you just pay her extra money also. Make sure she reach home and give the water and spray on it. Now this photo, I think is 2 or 3 days later. 3 days later, the hand recovery become like that. The leg, you can see the leg. This is February 2020, last year. February 2020, on the 18th. This is on the 18th. This after 4 days only, 3 to 5 days only. It's slowly dry up, You can see next the picture. This picture. This is about in May, if I'm not mistaken. This is May picture. May become like that already. So actually after that I can't contact them, because the pandemic, because of COVID-19. They actually stay. After 3 days, actually they start recovery. I asked the mother to come back to my factory to take more water and go back, because from the house to my factory about 12 hours to take bus. 12 hours. It's quite a far journey. Because Indonesia, the road and the transportation are not so advanced. This is February 21st. February 21st. This is the second time that they bring back the water for her to drink and spray on it. This is May, I think. This is what? May 12th. This is May 12th. This is May 12th. So after that, I cannot contact them already. You know why? Because it's pandemic. So I was so worried whether the girl still going well or not. In fact, I got a photo after that by January 2021. I think Chin, you had a photo, right? You can show her the latest photo. This is still May. This is still May. This is January. See, you see January 30th, 2021. Because I so worried whether it's really helped her or not. It's really fully recovered or not. So this is January 2021. It's all gone. This is all gone. So here I'm trying to say is if I'm not with the Kanken water, what happened? This girl, her destiny or her fate will become how to cure the problem, how to solve her problem. I really no idea. So it's lucky the 2.5 help her. Correct. You're lucky we have 2.5 to help her. So here I'm trying to share it out everyone here. If your house, you got a you got a water, you got a machine, please share more to other people's. And your business plan also share more with other people. Let more people benefit it. Let people actually can get the benefit out of can water by just using water. And with our business plan, let's share more to all. So everybody can change their health, change their life, I believe, and your life and your faith too. Thank you very much. That's my small sharing. Thank you.
Thank you, Jackson. Next, we want to invite Erica. Erica, you there? Erica, please on your video. You can unmute yourself, Erica.
Okay, already. So can I start now?
Yes, please.
Hi, good afternoon, everyone. My name is Erica. Let's bring everyone back to 1997. What happened to me before I met Kangen Water? In 1997, I was actually diagnosed with very serious depressions. Due to my dad's serious illnesses, he had lung cancer and passed away in 1997. So I was looking after him for more than 1 year. Without realizing this, I was already falling into very serious anxiety and panic attack. So my depression actually came, I was diagnosed with anxiety, depression and panic attack. It was really complicated. I was housebounded for more than 1 year. So during this time, I was actually highly medicated. I was on many types of medications at the same time. It was very high dosage. I couldn't go out from my house. There was only one of my very good friend that looking after me. So if my friend's busy, I will have no food to eat on that day because I was totally depending on my friend. And I couldn't even see my family members. I was cut off to the outside world completely. Until a year later, I was very blessed. I got recovered actually. But unfortunately, I actually had a relapse during a short period of time. But the housebounded problem has left me, so I started looking for a job when I first recovered. But when I had the relapse, it was worse. I actually had OCD. It was very serious OCD. Even though I can go out, I can work, I can see people, but I had a lot of imaginations in my mind. The serious OCD has caused me, kept washing my hands, kept checking on things, had a lot of imaginations within myself. My brain was going out of control. I was overwhelmed with a lot of thinking which had never happened to my life before. So I was really struggling every day. I couldn't shake hands with customer. I couldn't touch the public doors. I cannot go public toilets. So during that time, I had to started seeing doctor and medications again. So the relapse actually happened many times, multiple times in my life because of medications and doctors. I was losing my saving. I couldn't really work. I was facing financial difficulties, in fact. So sometimes I have medications, sometimes I don't have medications. So for the illness like this, you cannot just cut off medications. That's the reason why I had many types of relapse. So that went on for many years. Actually, to put up all together is 20 over years, yeah. But until the recent years, I finally realized one day that I cannot surrender to medications anymore. I need to help myself. So I did a lot of self-help. I did a lot of research on brain. What is going on with my brain? And this, you can see this picture. This is from one of the world famous psychiatrist, Dr. Daniel Amen. In his TED Talk, I took this picture. So he was the first psychiatrist that started doing X-ray on on his patient's brain, because he didn't agree with just talking to patients and diagnose them with medications. So he started doing scanning for all his patients. So can you imagine, just now that was the OCD brain. Can we go back to the OCD brain? We can see, right, for normal healthy activities, the red colors are the activities. It is supposed to be like this. So when we are healthy, so the OCD patient's brain will be like that. So the red color part are the activities. So it's like the alarm playing in your brain 24 hours a day. So it's totally out of control. You cannot live normal anymore, because you have to keep washing your hands, take long shower, checking on things. Maybe you're sleeping halfway, you need to get up to check on your fridge, you need to get up to check on your doors. So it's the normal life is totally gone. And I also found out this really shocked and overwhelmed me, drug abuse. So can you imagine how's my brain going to be? This is a picture of drug abuse. I've been having drugs for 20 years. So when I found out all this, for more reason, I wanted to help myself without medications. So I went on and on, doing a lot of research about nutrients and other things, but never think about water until the year of 2017, August 28. I will never forget this date. I installed my Kangen machine in my house, SD501. Then this was the medications that I was taking. This is only one type, yeah. I was on many types of medication. This is just one type of that. It's called Zoloft. So, okay, let's go back to what happened to me when I started drinking 8.5. As you can see, it looks like nothing much, right? But actually, I scratch until you can see my skin, the blood and the white meat inside, and you can see all these toxic actually coming out. It appears on my skin, and I was like, wow. Actually, the only changes I made was water. That's all. It was 8.5. And since we continue, you can see the rest of my picture. It was really terrible, but I wasn't even worried about it. In fact, I was really happy. I was like, what is this water about? So because of that, I continued drinking more and more Kangen water from 8.5 up to 9.5. But that was the time I wanted to do a test myself on this water. So I actually challenged myself. I was taking 3 types of medications. I was still taking that, 150 mg of Zoloft. And at night, I was taking Shuraqua and Remeron, these 2 types. And Zoloft was actually always my main medications. So that time, I actually tested on Remeron and Shuraqua, which is my night medications. I tried not to take the medications, just drinking the water. Because at one time, because of financial situations, my night medications couldn't replenish. So I actually found out that I couldn't sleep for 24 hours. I went on for 72 hours. I was awake. So it is really bad when you cannot sleep naturally. It's really affecting my health, not just mentally, physically. So then when I tested on Kangen water, I actually finally made it. I actually stopped my night medication few months after drinking Kangen water. So it's successful. And up to today, it's about 4 years. I am not on medication at all at night. So, and then later on, I took up even more serious challenges, which is Zoloft, my main medications. I need to take 150 mg a day. I failed multiple times with doctors, trying to cut that with doctors. So I always have to go up to 150 mg when I came down to 100 milligram. And today, I'm only taking 50 mg of Zoloft. So now my whole entire day, I just need to take 50 mg of Zoloft for the sake of maintaining and slowly cutting it by just drinking a lot of 9.5. I haven't even really drinking 11.5 though, just 9.5 Kangen water. So I continue drinking lots of water, and not only the medications has successfully cut, I'm not seeing doctor at all, yeah? I'm just taking 50 mg of Zoloft, and I'm having a much more active life. I have a lot of activities, you know. You can see that I was meeting friends, family. before that, I couldn't go back for Chinese New Year for 20 over years. Can you imagine? 20 over years, I couldn't join Chinese New Year. So, but I went back to see my mom. I went back to see my relatives after 20 over years because of Kangen water. I even managed to have a new mission for my life. So Kangen, to be sharing Kangen water, the goodness of the water, regarding mental and physical health has become my life mission. So what can be more important than that? It is really, because it's been 20 over years, it's a very long story, but the major change, actually the only one thing that I changed was Kangen water. It wasn't any other things. I wasn't seeing any other doctors. So if it's not a water, if it's not because of Kangen water, what else can that be? So from the bottom of my heart, I really hope that people can really take serious thoughts about having good water for their life, because after helping me in my mental health, it helped me in my physical health. Can you imagine holding your urine, your toilet time? When you're outside, you can't go public toilet. It sure will affect the kidney. And when you have a high dosage of medications, you could see just now the brain scan, and also it's very bad because we cannot sleep naturally. So it definitely affects physical health as well, besides mental health. So seriously, I want to convey this message to everyone from the bottom of my heart. Kangen water has really given me back my second chance of living a meaningful life with my life mission. Yeah. So that's all.
Thank you,
my sharing.
Erica.
Yes. Thank you.
Thank you, Erica.
Thank
That
you.
was wonderful. Thank you, Erica.
Thank you.
Last, we just quickly want to Shirley. All right. So Shirley is going to share with us her amazing stories of COVID, right? Shirley, please. We have 3 minutes, Shirley.
对，谢谢师傅亲啊，我讲华语啦啊，我是
Okay, I
Shirley
will translate.
在4年前我确诊了这个非淋巴管平滑肌增生了，这个是一个很罕见的病
Many years ago, she is diagnosed with cancer lung.
师傅亲，我说英文哈。直接说
OK， 你用英文蛮好。OK， all right。
可是我尝试一下啊。So 4 years ago, I was diagnosed. It is a very rare lung disease, affecting only 5 out of 1 million people. By the time being, it is not curable. Only one medication that is the progress of the disease. As time goes by, my condition deteriorated, and I started to have a collapsed lung. So started to admitted to hospital frequently due to pneumothorax of holes in my lungs, and the right side of the lung is collapsed. And at that time, I was admitted into ICU. It is my condition is very poor, and I need to put on 24 hours oxygen and bed rest. I can't move all around. Even I was resting on bed and put on oxygen, I still feeling breathlessness. And later on, my condition is become a little bit stabilized, and I was discharged to home. After discharge, I need to put on 24 hours oxygen, and when I go outside, I need to use the wheelchair. It is greatly affecting my quality of daily life. Later on, my friend introduced Darren Ho to me. He come to my house, come to my home and introduce Kangen water to me. And then he asked, "Do you want to try Kangen water?" Then I think my condition is water is is quite safe for me. So I decided to try the Kangen water. After 1 month, it's significantly improved. And then he come to my home and the tumor. After I take the Ukon, I cough out some very sticky sputum, very sticky flame, and I feel my lung become more clear. You can see, I need to put on the oxygen when I go outside. It is quite anxious for me because the oxygen machine is using battery. I must go home before the battery run out. And then after I use Kangen water and Ukon, my condition become improving and improving. And after about 6 months, I can manage to finish a 5 km run. It is quite amazing for me, and all of my family and friends are very happy about that. But later, this year, January of this year, I was confirmed COVID positive. My daughter is quite worried about me because my lung condition. There is no. I can't deteriorate anymore. When my lung condition become deteriorate, I may need to put on the oxygen again. So later I was admitted to Sungai Buloh Hospital. And in Sungai Buloh Hospital, my condition is not quite satisfactory. It's quite breathless, and I can't even take bath myself. Later, I was discharged to home with no treatment. And then when I discharged home, I restart my Kangen and Ukon. So after taking the Ukon, the next day, I found my breathless, my condition of breathless become improved significantly. But I take quite high dose. And so I think in my experience, Kangen water and Ukon can improve my general condition, and especially when we have some inflammation, quite severe inflammation condition. So now I'm introducing Kangen water and Ukon to my friends and my people around. Thank you.